you, Mr. Deputy Speaker. Mr. Deputy Speaker, I'm delighted to be opening this debate on the Department of Health and Social Care's main estimates. My remarks today will focus on the recent spending review, which includes some welcome funding increases and sets out some ambitious reform objectives. However, it also raises questions about deliverability, particularly on capital investment, efficiency savings, and the role of social care. Let me begin with capital investment. The government has rightly emphasised the need to shift from analogue to digital systems across the NHS. The nearly 50% increase in technology and transformation funding reaches up to £10 billion by 2028-29 is a welcome and substantial commitment. However, Mr. Deputy Speaker, the NHS has a poor track record on digital transformation. The National Audit Office has previously highlighted the risks around fragmented delivery, unclear governance, and unrealistic timelines. These lessons remain highly relevant. Its 2020 report on digital transformation in the NHS found that despite £4.7 billion in national funding, many trusts were still reliant on systems that are outdated and not integrated. The capital budget is being asked to do a great deal more alongside digital transformation. The government has committed to the new hospitals programme and to addressing critical infrastructure risks such as RAF. Over 5 years, £30 billion is allocated for maintenance and repair, with £5 billion for critical risk. However, by the end of the decade, there will be no real terms uplift in the capital allocations compared to this year. In fact, in 2027-28, the funding settlement actually falls to £13.5 billion from £14 billion the previous year. This means that inflation in construction costs and materials will significantly erode its purchasing power. The British Medical Association has warned that current funding cannot cover both the new hospital programme and essential maintenance, and now the programme must also compete for funding with the vital digital transformation. So can I ask the Minister how they will prioritise between these competing essential demands on a capital budget? Turning to resource spending, the department day-to-day budget will grow by an average of 2.7% per year in real terms. This funding will be used to deliver several welcome commitments, including investments in elective recovery and urgent emergency care, a £4 billion increase in adult social care funding, 700,000 additional urgent dental appointments annually, 8,500 more mental health staff, and 80 million a year for tobacco cessation programmes. These are all positive steps. However, underpinning this settlement is the government's pledge to generate £17 billion in efficiency savings over 3 years, with a staggering £9.1 billion expected in the final year of this Parliament. Critically, Mr. Deputy Speaker, these savings have already been factored into the settlement. In effect, they've been spent before they've been delivered. In light of this, we need absolute confidence that there is a clear and robust plan to generate these savings. The government is assuming an annual productivity improvement in the NHS of 2%, more than triple the long-term average of 0.6%. The government appears to be relying on digital transformation to unlock the bulk of these savings, which is risky given the history of digital change programs in the NHS. Another source of savings is the plan to cut the reliance on temporary staff by reducing sickness and absence and overhauling staff policies, including limits on agency spending and eliminating agency use for entry-level roles. Again, a welcome ambition, but a significant challenge to deliver. It will require meaningful, sustained improvements to staff well-being and working conditions. We cannot build a sustainable workforce on goodwill alone. Therefore, can I ask the Minister when we can expect an updated and fully costed workforce plan to deliver on these ambitions? Delivering the Reforming Elective Care for Patients plan is also central to achieving these efficiencies. It proposes reforms such as optimising surgical pathways through hubs, streamlining referrals and expanding remote monitoring and reducing unnecessary procedures. The plan assumes a rapid transformation of services with significant improvements in productivity and patient flow expected within just a few years. This is ambitious, especially given the context of ongoing workforce shortages, ageing infrastructure, and rising demand. Reform is essential, Mr. Deputy Speaker, but it must be realistic, properly resourced and paced to succeed. We cannot afford to set targets that look good on paper but falter in practice, damaging morale and patient care. So what steps is the Minister taking to ensure that this projected £17 billion in savings will materialise and be delivered on time? And also, what happens to those additional resources for frontline delivery if they are delayed or fall short? I want to also touch on adult social care. Adult social care is in desperate need of reform, and the Casey Commission has an important job to do. However, the terms of reference for the first phase of Casey's work states clearly the Commission's recommendation must remain affordable, operating within fiscal constraints of the spending review settlements. Now that those settlements have been reached, can the Minister provide clarity to the House about precisely what the fiscal constraints are that Baroness Casey's recommendations will have to conform to? The £4 billion for adult social care announced in the spending review includes an increase to the NHS minimum contributions to the Better Care Fund. My committee considered the Better Care Fund in our inquiry into adult social care. It was introduced with the aim of driving better integration between health and social care and shifts resources upstream from the NHS acute services. However, the evidence we heard was stark. These resources have been overwhelmingly focused on hospital discharge. While timely discharge is important, this does not match the fund's original objectives. So can I ask the Minister how they will ensure this increase in funding leads to greater focus on prevention? Finally, on adult social care, the Chancellor referred to the government's plan for an adult social care fair pay agreement. Reaching this agreement is not just desirable, Mr. Deputy Speaker, it is essential. Staff working in care homes are far more likely to live in poverty and deprivation than the average British worker. This is both morally unacceptable and economically short-sighted, fuelling the workforce crisis. Can the Minister provide the House with an update on what concrete progress has been made on establishing the Fair Fund Agreement? Furthermore, will the funding required to pay for this essential agreement come out of the £4 billion that has been announced for social care? In conclusion, Mr. Deputy Speaker, it is clear to me that the main estimate and spending review presents a vision of reform, but it is also a vision built on some highly optimistic assumptions. We need to see robust, detailed plans to deliver the digital transformation and the unprecedented scale of efficiency savings that the Minister is counting on. Without these plans, and without realistic assessments of the challenges, the risk is not just that these reforms fall short, but they do so at the expense to frontline services, patient care, and to the morale of our dedicated health and social care workforce. I urge the Minister to address the specific questions I have raised today. Thank you, Mr. Deputy Speaker. Thank you.